So homeopathy was founded by a German doctor named Dr. Samuel Hahnemann in 1807. It was introduced in India around 1810 by one of Hahnemann's disciples, John Heinsberg. In 1978, Central Council of Research in Homeopathy was established. Uniform education in homeopathy was enforced by the Indian government in 1983. A Department of Alternative Medicines was formed by the name of Ayush. Along with homeopathy, it handles all traditional forms of medicine like Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Soga-Ruppa. Indians were able to identify with homeopathy as it was cost-effective, without side effects, and did not require any diagnostic tests. Hahnemann was an allopathic doctor and was not happy with the allopathic practices of purging and bloodletting at that time. So one day he made a discovery. He started taking regular dose of the bark of a China tree, which was quinine. This, he said, produced all the symptoms of intermittent fever or malaria. This made him think that if the crude substance can produce a symptom, a diluted and potentized version of the same material will cure it. This was the principle of like cures like. So if drinking too much coffee can cause sleeplessness, when coffee is made into homeopathic medicine, it could be used to treat sleeplessness. Cutting onion causes eyes to water. So alum cepa, a remedy made from onions, will cure watery discharge from eyes and nose. Now we go to the principles of homeopathic philosophy. Homeopathy believes that man is a vital force or soul that annihilates the human body. Man gets sick in the vital force before his organs get sick. It is the vital force that senses everything, and all derangements can only be felt by morbid sensations and functions of the affected part. I'll try and explain you that with an example. Our heart is beating in our body 24/7, but we don't feel our heart. Though it's beating, the blood is moving around, but you can't feel it. So the time when we start feeling the heart is when we have a palpitations or pain or a crampy feeling, then we start feeling the heart. That means there is something wrong with the heart when we feel it. Those are the morbid symptoms and sensations we're talking about. Homeopathy believes man is sick much before his organs are affected. So removing a part that has cancer will not cure him. Sickness is in the whole man and tumor is just the end result. Same applies for skin eruptions. Removing the eruptions with creams will only push the disease inwards, ultimately affecting your weakest organs. We have to remove the cause. What are the symptoms of disease? We say a virus invades the economy. We initially become sick and we get to know about the symptoms by disagreeable sensations and morbid symptoms. Disagreeable sensations could be headache, breathlessness, lethargy, morbid symptoms like cold, cough, pneumonia, etc. So when we say, I feel something, these are the signs and symptoms by which we are able to recognize the disease state and find the remedy. So here in this case, you say, if I feel my heart palpitating, that is a symptom that we need to find your remedy. In the later stages, however, the original symptoms disappear and the body is full of the disease results like dropsical conditions, pus sacs, or hip joint diseases. Then if you prescribe for end results like silica for hip joint disease or bufu for epilepsy, we cannot cure it. We have to find the initial signs and sensations, the signs given by nature we have to find out. So how we get sick? Apart from injury, we get sick in the vital force by either mental emotional shock or by physical shock. Mental emotional shocks could be deep grief, prolonged anxiety, terror, disappointment. And physical shocks could be infectious diseases, exposure to elements, chemicals, etc., trauma, malnutrition, or extreme exertion. With our medicines, we can make a person healthy on the physical, emotional, mental level by taking away the pathology of the disease. Under healthy conditions, every person has some traits of personality. Now, these are exaggerated by the disease. For example, if a person is very quick and perceptive by nature, under the influence of disease, he may become very irritable if people don't understand him. This shows a pathology starting. He then fights with his friends, relatives, his wife, and after fighting with everybody, he finds that he is isolated. Then depression comes in. So if pathology is left untreated, it exaggerates our negative personality and gives us a feeling that we are going away from happiness. Which brings us to the definition of health. Man exists on three levels: physical, emotional, and mental. And the one word that would describe health on all three levels is freedom. So health on the physical level is freedom from pain. Because if you are in pain, you're a slave of the pain. You cannot think of anything else. But some people don't experience pain. They have a general feeling of malaise or tiredness. So a complete definition would be that freedom from pain with a general sense of well-being will be health on the physical front. Health on the emotional level is freedom from passion, which means no passionate attachment to an idea or person, because that makes us a slave of the passion and we become irrational. But with freedom from passion, we should not be apathetic, that is, not having an interest or feeling towards anyone. We should be active and interested with a sense of dynamic serenity or calmness. So if we do not have passionate attachment to anything, there is no irritability, and we can face everything with dynamic calmness. Though this is a state very difficult to attain, it should be our target. Health on the mental level will be freedom from selfishness. Again, a state very difficult to attain because we all are selfish. Whatever begins with I is all selfishness. I want this, I want that, are all selfishness. Freedom from that would mean not seeing yourself as a separate human being, but as one with cosmic consciousness, that is one with God. If I can eliminate that I am anything, then I am one with consciousness. Now it is very difficult to eliminate selfishness, but we have to try to reach that goal to remain healthy. So when a patient comes for homeopathic treatment, we have to understand where they stand in their shortcomings and in their deviations from health, and try to heal their suffering on a very deeper level. So how these mental shocks affect us, mental, physical, emotional shocks, how do they affect us? When the vital force is disrupted by a physical, mental, or emotional shock, to preserve life, it must remain clean. So it passes these shocks to the body, which manifests them as acute or chronic diseases. Acute problems could be like flu, headache, gastroenteritis, fever, etc. And chronic diseases could be lung complaints, digestive problems, skin disorders, arthritis, etc. So when a person has some acute disease, they usually try to treat it with, say, antibiotics, anti-inflammatory drugs, or cortisone, depending upon what problem they have. To that, there can be two possible outcomes. You can either get rid of the disease with antibiotics, and then your immune system will try and get rid of the antibiotic or chemical to restore health, and the problem is solved. But there can be a second scenario. That is, if your immune system is not strong enough to cure the acute disease and get rid of the chemicals, it then submits to the power of the drug. And the acute disease becomes a chronic degenerative disease. Now, what chronic disease will follow will depend on the genetic predisposition of the person. The genetic predisposition is inherited from parents. So if a person has, say, a genetic predisposition of asthma, he is going to develop asthma as a chronic disease. If the predisposition is towards developing an ear problem, he may develop deafness or things like that. So it is not the antibiotic or the chemical that will create the problem, but that chemical or antibiotic will trigger a genetic predisposition, which we call a miasm in homeopathy. So that takes us to the study of miasms. Miasms is another way of getting sick, and that is through hereditary. Miasms are inherited or acquired tendency of a disease. So you can either inherit the miasm, or you can be the first one to start the miasm. So you acquire that tendency. We consider a person to be under miasmatic influence when well-selected medicines act for a short time or not at all. Hahnemann gave us 3 miasms, basically psora, syphilis, and psychosis. Psora starts with an itching or eruption. These are outward manifestations meant to protect us from internal damage. But we usually apply creams, etc., and try to get rid of the eruptions. And though we should remain healthy as long as we have those manifestations, but we try and suppress them, and so the disease is pushed inwards and manifested in some of our organs as a disease. Syphilis, we get from sexual contact with the syphilis person who's infected with syphilis, or we can also inherit it. Syphilis usually begins with the cancri appearing somewhere in the body, which is usually removed surgically. Then the nerves get affected. We take medicines for those, and then the bubo appears, and ultimately we have ulcers in the throat and the hair fall off. Psychosis is also a sexually transmitted disease, but we can also get it by vaccinations or suppressions on any level, mental or physical. This psychosis is recognized by growth of fig warts, which is the leading symptom of psychosis. In this, gonorrheal discharges occur as pus from genitals. We suppress it, and we get rheumatism, sore throat, asthma, and nerve troubles. Later, tuberculosis and cancer were added to the list of miasms by the doctors. I'll try and explain to you miasms with the help of some examples. Supposing a person has asthma, and we are treating him for quite some time, and we don't get any positive results. Then it comes to our knowledge that his asthma started after suppression of a bad flu he had. So then we have to give him a dose of influenza, which will get rid of the miasmatic influence of the bad flu he had earlier. And then later, the medicines we give him will start acting. Another example will be if, supposing we are treating a person and he has no response on the medicines we are giving him. And then later we find that he has a history of tuberculosis in the family. A dose of tuberculinum will be required to remove the tendency, and then medicines we give later will start acting. Another example could be if a person is having headaches, and we find that her father had a history of malaria for which he had taken a lot of quinine. A dose of China sulfurica will be necessary to remove the miasm so that we can give the medicines which will act. Another case would be a case of agoraphobia, or a fear of crowded places. While treating such a case, at one time, it came to our knowledge that the woman was bitten by a rabid dog, and after that, she had a lot of rabies injections. So she was not responding to any drugs. A dose of hydrophobinum had to be given so that medicines could act. These are only examples of medicines I've given you. please don't treat them as prescription drugs. So in all these cases, we see that an inherited or acquired cause has created a predisposition for chronic disorder. This predisposition originated as a specific cause, a microbe, a virus, a drug, or a chemical, and was transmitted to the next generation, like a father had taken excess quinine and the daughter was suffering from its effects. And unless this predisposition is connected, you cannot cure the case. That brings us to homeopathic medicines. So since the disease is in the vital force, is on the dynamic plane, medicines to heal them should also work on a dynamic level. So our medicines are potentized and diluted in such a way that there is no material substance in the disease. There are 3 scales on which medicines are made: the decimal scale, centesimal scale, and millisimal scale. Decimal scale is denoted by X, centesimal scale by C, and millisimal scale by LM. In decimal scale, we make the medicines by diluting them with 1 drop of medicine to 10 drops of alcohol for every potency. So if you're jumping potency from 1 to 2, it is once. 1 to 3 will be doing it thrice. So in say centesimal scale, when it's diluted from 1 to 100 and we go till the 200 potency, like this, there is no material substance left in the medicine. So how do our medicines work? Our medicines work on the principle of simila similibus curantur, which means like cures likes. So if a person develops symptoms of fever, you have to find a medicine which will produce similar symptoms of fever. When given to a healthy man, this medicines will cure him. How? When a person is attacked by a virus, say, it thrives in our body at body temperature, but dies at a higher temperature, say 103 degrees Fahrenheit. So our self-defense mechanism tries to raise the body temperature in the form of fever to the required level of 103 so that it can kill the virus. If it succeeds in killing the virus, we are restored to health again. But if the vital force is too weak and it cannot raise the temperature to the required level, it can also die. So our medicines will produce similar symptoms, help the body in raising the temperature to the required level. So by example, I was thinking I'll discuss one medicine with you so that you could understand how the medicines work in homeopathy. We'll take up the very starting medicine, aconite, which is an acute medicine and also works as a chronic medicine. So as an acute, aconite works on, say, watery discharges from nose and cough caused by exposure to dry cold winds. Here it is used as a winter remedy. So it won't work in summers if you have a cold. If you have an exposure to the cold, say, I'll give you an example. Say if you're going to a winter wedding in farms, etc., in the open air, and you're not wearing adequate clothing. So you might catch a cold there, and within a few hours, you'll be down with a bad cold. Aconite will be your remedy there. In summer complaints, it has mostly diarrhea. In summers, if you get the hot air, the problem you'll get will be mostly diarrhea. For cold in summers, you don't give aconite. But it also has some chronic complaints. And the chronic complaints are mostly mental shocks caused by fright of a traumatic event in which the patient can see imminent death. I'll try and explain those with some examples. There's a man standing with a gun trying to shoot you. You're seeing imminent death coming in front of you. A shock of that type will require aconite. Also, the mental effects of an automobile accident where you're seeing imminent death coming and there's a shock will require aconite. Similarly, if there is an earthquake there is extreme fear with imminent death, Aconite will be required. Supposing a person is trapped in an elevator or a dark tunnel and he develops symptoms, same Aconite will be required then. A patient hears that his operation might end in death through a doctor or overhears to somebody, then that will bring some fears in him, which will require Aconite as a medicine. So these shocks that we get, they penetrate the whole body and produce phobias, especially fear of death. They can produce vertigo, numbness of one side of the face or body. But these symptoms generally do not stay for long. They last for a short time, but they keep coming back again and again. In chronic cases, a person can predict his time of death. He will say, I will die in 3 months. So I have made all arrangements. But this is not natural. You have to treat him as pathology. Apart from fear of death, Aconite also produces fear of dark and claustrophobia. A patient will sleep with lights on, or he will not go in an elevator, but rather take the stairs. They also have fear of accidents. Aconite is also used in retention of urine due to fright. So if a newborn has retention of urine due to shock of coming into this world, Aconite will be the medicine. Aconite also cures inflammation of ovaries in cases of suppressed menses. So with this talk, I have tried to explain to you how homeopathy works and try to make it easy for you to understand. Hope it was beneficial. Thank you.
So you first said that, that was very interesting. Freedom from passion and with dynamic calmness. This sounds like Krishna in the Gita. Is this what Hanuman had actually written, or?
Yeah, exactly. You see, in his book, Organon, he's written all this. These are the mental symptoms. So actually these things, when taken to an extreme level, do bring out ill health. So they're not advised to go to an extreme level in all this. They will bring ill health if you've gone to an extreme. Of course, you can say that maybe if I'm passionate, then only I can do some work or something. But then if you take it to an extreme, it generally leads to an ill health.
Okay. And so Hanuman, did he have any influence? I mean, was he discovering this on his own, or this sounds like very Indian philosophy, Indian spirituality. Do you know anything about whether he was influenced or was he discovering this on his own?
From what I know, I think he did read some Greek philosophy and all. So maybe he was influenced by that. But a lot was his own thinking also.
And you said that miasms. So you can either get it genetically, or you can even start a miasm. So how do you start a disease? Because you said that the predisposition is what determines the type of disease you will get. So
yeah, but somebody has to start it, no? If say you get psychosis by vaccinations is one of the cause of developing psychosis. So if you have too much of vaccinations and all, and you develop symptoms of psychosis, you will pass it on to your children. But it has to start somewhere. So,
got it. Okay, and then it was very interesting that, say, a medicine that you will give for curing a disease is actually helping raise the temperature of the body. So it's actually aggravating the symptom. It's almost like that.
No, it doesn't actually aggravate the symptom. It just creates a parallel sort of a disease which helps the body to fight the disease. This artificially created disease actually just subsides on its own later. So we don't get sick with that disease, but it just helps the vital force or our immune system to help through the disease by raising similar symptoms.
Okay. And so the example you gave, for example, aconite, I mean, so it is basically being used for multiple types of things, and also the weather or the environment that the person is in will also differ. But what about cold places? For example, in Germany, where it's cold all the time, would summer, winter, would that affect or no?
Yeah. Aconite is basically a winter remedy for acute diseases. It usually develops very severe colds or cough, etc., with watery discharge. But when that happens in winters, when you're exposed to the cold air, and then that happens, then your medicine is aconite. But if you develop that in summers or even spring or autumn, then aconite is not your medicine. So looking at the weather is very important while selecting the remedy, acute remedy like this. Okay. But it is also used in chronic cases of fear, in which there is fright and the effect of the fright remains.
So what sort of effect? I mean, when you said that fear of
the effect I told you, that you might develop a fear of death, or you might develop numbness of your face, half the face or half the body, or things like that you develop as symptoms of aconite. Mostly it is fear of death.
So how do you, I mean, discriminate between, like most human beings would have fear of death? How do you discriminate between a patient versus somebody who's healthy and have both have the fear of death?
No, I disagree here. A normal person will not have fear of death. If you have fear of death, then it is pathology starting. It is not healthy. And in the aconite's cases, when a person has fear of death, he will usually predict the time of his death. He'll say that, okay, in so time, I'm going to die. Say, I'll die after 2 months, 3 months, I'm going to die. If when you hear that sort of thing from somebody, that is not natural, that is not normal. That means he's under influence of some pathology and he requires a treatment.
Okay. And from you, I've heard about constitutional medicines versus acute medicines. What is the difference between these two systems?
Acute medicines usually act on acute cases. Like acute cases would be things that you have developed from the environment. A virus invaded your body and you got sick. Or you ate something and you developed an upset stomach. From external causes, you develop symptoms, which are acute symptoms, short lasting, which don't last very long. Chronic are usually when some derangement has happened in your body internally and your body is not functioning properly. Those are chronic disorders. Medicines for both are usually different. The short-acting medicines and the long-acting medicines. Chronic medicines will act on chronic diseases and acute medicines will usually act on acute diseases.
Okay, and so in the example of aconite, for example, if there is a person, like you said, fear of imminent death in terms of, say, passing through a tunnel or something like that you mentioned, so would that, and if it has long-term recurring impact of face numbness or whatever, would that be considered like a long-term?
Yeah, actually, aconite is a polycrest. Polycrest means it is used in more than one case. Plenty of cases it is used in which aconite is used as an acute, mainly what people use as an acute disease medicine. But in this case, these symptoms that I told you are chronic. So it treats acute as well as chronic cases.
Thanks so much for your presentation. I had a query, like you gave the example of aconite. So I wanted to know, there are so many other, so many issues that are there, diseases or symptoms that you're looking at and treating with aconite. So if you're giving Aconite, say I just have a cough and cold, but somebody else has this fear of death. So if I'm getting the medicine, will it not, aggravate other symptoms in me? I mean, how does it work?
No, actually, homeopathic medicines work on the symptoms you have. The pathology, everybody can have different symptoms and still require the same medicine. But that doesn't mean that his other symptoms will get aggravated, because the medicine only acts on the symptoms you have developed. It will not act on the symptoms that you haven't developed. So in that case also, I'll say that if a person has no symptoms and he takes the medicine, mostly it has no effect if taken in a moderate quantity. It will have no effect on you.
Namaste Sanjeev ji, namaste Rahul ji. It was an interesting talk. लेकिन मेरा एक बड़ा पुराना सवाल है जो मैंने बहुत जगह जानने की कोशिश की है, जिसका आंसर नहीं मिलता, और वो है कि होम्योपैथिक मेडिसिन का मैकेनिज्म ऑफ एक्शन क्या है. आपने भी बताया कि डाइल्यूशन करते करते कोई मटेरियल तो उसमें बचता नहीं है, तो अगर मटेरियल उसमें नहीं बचता तो मेडिसिन एक्ट कैसे करती हैं, ये सवाल का आंसर कभी मिला नहीं जी.
सर, वो काम ही तभी करती हैं क्योंकि उसमें मटेरियल सब्सटेंस नहीं बचता. दे एक्ट ऑन अ डायनामिक लेवल, एंड if you've used homeopathic medicines, then only you will understand that they really work at that level. People who give mother tinctures or these sort of medicines are actually practicing more allopathy than they are practicing homeopathy. So dynamization से ही उसका जो dynamic level है medicine का वो बाहर आता है, तभी वो medicine आपको act करती है in homeopathy. अगर वो dynamic level नहीं होगा तो it won't work for you as homeopathy. It will work for you as allopathic medicines work.
ये dynamic क्या है? Energy है क्या?
Dynamic energy है.
So हम इसे force या प्राण शक्ति जैसे योगा में
exactly. That's it.
नहीं, अब मैं ऐसा ये प्रश्न ऐसा है कि ये शायद होम्योपैथी का इटर्नल क्वेश्चन है, और हम जो विज्ञान हमें बचपन से पढ़ाया जाता है 6ठी क्लास से, उसमें वही बताते हैं कि, और बाद में भी, जैसे मैं तो बायोकेमिस्ट्री पढ़ी फिर पढ़ाई यूनिवर्सिटी में, तो मेरे बिल्कुल समझ में आती नहीं है होम्योपैथी, सिवाय इसके कि मैं देखता हूँ कि लोगों को एक्ट कर रही है, लोग दवाई ले रहे हैं और ठीक हो रहे हैं, लेकिन वो कैसे ठीक हो रहे हैं ये मेरी समझ में अभी तक आया नहीं, क्योंकि जो हमने पढ़ा है बेसिकली वो एलोपैथिक सिस्टम के हिसाब से पढ़ा है, और मुझे लगता है इसमें सिस्टम नहीं जाना चाहिए कि वो एलोपैथी है कि आयुर्वेदिक है कि होम्योपैथी है, क्योंकि बेसिकली हमारा शरीर तो कोई भी सिस्टम वो वही है, उसके मॉलिक्यूल्स तो वही हैं, उसका सेल स्ट्रक्चर तो वही है, कि जब एक मेडिसिन हम लेते हैं, चाहे वो होम्योपैथी का मदर टिंचर हो या एलोपैथी हो या होम्योपैथी हो, उसमें केमिकल्स हैं, वो जाकर सर्टेन प्रोटीन्स या एंजाइम्स या रिसेप्टर्स पर एक्ट करते हैं, उन्हें मॉडिफाई करते हैं, उससे केमिकल रिएक्शंस होती हैं. तो ये होम्योपैथी बड़ी मिस्टीरियस सी चीज़ है मेरे लिए, मतलब कुछ मैजिक टाइप चीज़ है, कुछ मिस्ट्री है, और जितनी भी थोड़ा विज्ञान के विद्यार्थी होने नाते मैंने जो कुछ भी पढ़ा है मेरी समझ से बाहर है इसका मैकेनिज्म ऑफ एक्शन.
सर, आपको समझ आएगी अगर आप अपने विज्ञान से गॉड को एक्सप्लेन करने की कोशिश करेंगे. आप जिसको देख सकते हैं उसी को ही मानेंगे, तो आप गॉड को अगर एक्सप्लेन कर सकते हैं तो ही आप उसको मानेंगे, तो आप फिर होम्योपैथी नहीं समझ सकते. You have to see on some things that science doesn't know about as yet. This is a dimension about which maybe science doesn't know too much about.
But exactly, Sanjeev ji, yoga और आयुर्वेद भी pretty similar forms में, मैं for example naturopathy में राजेंद्र जी, एक जो philosophy is that आप अपना खाने को कंटेन करिए, अपनी अल्कलाइन डाइट्स इंक्रीज करिए, एसिडिक डाइट्स कम करिए. बेसिकली जो बॉडी की प्राण शक्ति है, यू आर ट्राइंग टू क्योर ऑल डिजीज वाया द प्राण शक्ति ऑफ द बॉडी. एंड दिस इज द सेम थिंग इन आयुर्वेदा. आप ये मानेंगे अगर कि आयुर्वेदा में कुछ सब्सटेंस अंदर जा रहा है, तो सब्सटेंस तो जा रहा है मगर उसका फिलॉसफी अलग है वात पित्त कफ की. और एक्चुअली सेम सब्सटेंस दो अलग अलग लोगों पे अलग अलग इफेक्ट ला सकता है. तो एग्जैक्टली सेम पैटर्न मुझे तो होम्योपैथी में भी दिखता है वैसा ही. जी सजीव जी, कुछ क्लोजिंग कमेंट. एक चीज पूछनी थी कि ये जैसे अभी गवर्नमेंट ने कोविड के केस में वो बोला हुआ है कि कुछ प्रिवेंटिव मेडिसिन और समथिंग, बट आपसे सुनने के बाद ये लग रहा है कि सिर्फ सिम्टम पे काम करती है तो प्रिवेंशन तो कुछ हो ही नहीं सकती.
Exactly. So actually, if you ask me, homeopathy cannot be used as a preventive, because homeopathy only acts when you get the symptoms. So there's no preventive in homeopathy. If you take, like in an epidemic, you're taking medicines, you're just giving the medicines so that maybe some people who have already started developing the symptoms, medicine will act on them and their symptoms won't aggravate. यहाँ तक ही काम करती है. But if you don't have any symptoms and you're not affected by the epidemic, then taking that medicine will not help. Thank you.